Hi class. This video lecture is on velopharyngeal nasal function in speech production. It corresponds to chapter 4 in your textbook. As usual, I will not read the slides to you. That would be boring for you. You can read them for yourselves. The purpose of the slides is to help guide you in your studying. There are a few things within the chapter that you are not responsible for. So as with every chapter, I use the slides and my video lecture to guide you in what information you are responsible for. One word of caution: the articulatory resonatory teaching module does not contain much complex physiology. So that's good news. Both the breathing and the phonatory systems did contain complex physiology. However, this articulatory resonatory module includes a ton of muscles. Over the course of the 3 video lectures in this module, a large number of muscles will be presented. You must learn these muscles slowly. Don't try to study and memorize them all at once. It just won't work. So plan your studying to learn a few of the muscles every day, okay? So slide 2, first we're going to have a very brief overview of this section, all righty? Slide 3, recall we introduced the source filter theory of speech production in the phonatory system. We said that the source is the acoustic pressure wave generated by the vibrating vocal folds. Now, in this module, we will be examining the vocal tract filter function. The vocal tract filters or shapes the acoustic pressure wave into meaningful speech sounds we call phonemes by changing the size and shape of the various segments or cavities of the vocal tract. We can divide the vocal tract briefly into 2 segments, the nasal and the oral pharyngeal and, the nasal and the oral segment. The pharyngeal segment can be considered a third cavity as well. We're going to look very briefly at the oral cavity, but mainly we're looking at the nasal pharyngeal cavity. Let's examine the structures. Okay, in video lecture part 2 on oral structures, we'll go over the cranial skeleton in detail. For now, I just want to give you this overview of the structures. Slide 7 describes the locations of the subdivisions of the pharynx, nasopharynx, oropharynx, laryngopharynx. I've mentioned these divisions in earlier lectures. You know, one thing I was thinking of when we go back to an earlier slide where I talked about the vocal tract being divided into 2 segments, and then I said 3 segments. In terms of thinking about the flow of air going from the lungs out into the atmosphere, we can think of the vocal tract as being divided into 2 segments. The airflow can go out the oral cavity. Here the lips are closed, but if they were open, they'd go out the oral cavity. Or the airflow can go out the nasal cavity, or it can go out both, and that's controlled by the velum, and we'll talk about that. From the viewpoint of filtering, though, the airflow, once it's generated by the vocal folds, we can think of the pharynx, the oral cavity, and the nasal cavity. So that's where we go from 2 to 3. Okay, I just wanted to kind of clear that up. I could see a couple of hands raised in the back of the classroom wanting to ask me about that. Okay, slide 8. Here we have some important landmarks of the oral cavity and oropharynx. We'll come back to the anterior and posterior faucial pillars later, and the tonsils, and the hard palate, and the teeth, and the lips, and the velum. Start learning these landmarks. Slide 9 introduces the velum, the velopharyngeal port. It's the extension of the soft palate and the uvula. It's made up of connective tissue and muscle fibers, and it is critical for opening and closing the nasal cavity. Slide 10, the nasal septum. The division between the right and the left nares is composed of several segments that are important for you to know. And we'll be talking more about the ethmoid and vomer bone and the palate when we get to the section on bones. Slide 11, the nasal cavity is actually quite large. If you stick your finger in your nose, I know you don't, but if you did, you can't access this whole nasal cavity with your finger. Thank goodness you can only poke your finger into this little nasal vestibule, all right, which feels like the nose goes up, but in fact, the nasal cavity goes back, parallel to the oral cavity, but above it. Here in slide 12 are some important landmarks of the outer nose I'd like you to know. I draw a line through landmarks or terms that are not important for you to know. Okay, let's look at the, excuse me, let's look at the pharyngeal muscles. There are 6 muscles of the pharynx. Know each one of these. That is what happens when each of them contracts, what their function is. And do make a good effort at learning how to spell them. I know that some of these names are absolutely tortuous to spell, whether or not English is your native language. I don't make these up, guys. All right, slide 15. I will not ask you in a test to label the pharyngeal muscles from a diagram. Yay! But I do supply the diagrams of them in the slides because I think these help you visualize where they're located, and which helps you then to understand their function when they contract. So if you look at these muscles and you say, oh, what happens when this contracts? You know, what might that do? And it's critical for you to know their function. So slides 15, 16, and 17 show these muscles, their names, their pictures, and what their function is upon contraction. Learn those. All right, here in slide 18, the diagram shows how the contraction of each muscle acts upon the pharynx. It's just kind of a stylistic summary, if that helps you. Let's move to slide 19, and we're going to look at the velar muscles. Okay, there are 5 velar muscles. Again, I will not ask you to identify these muscles in a diagram, but know their names, know how to spell them, and what their action is upon contraction. It may be helpful for you to study them grouped by function, the velar elevators, the velar depressors. That means lowering the velum. That doesn't mean making them sad. And the eustachian tube dilator. Whoops. All right, so each of the velar muscles is shown and described in slides 21, 22, 23, and 24. Slide 25 shows a diagram of how the contraction of each muscle acts upon the velum. And here on slide 26 is one more series of images of the velar muscles. It may help you to visualize their location, to learn their function. I will not give you these muscle diagrams and ask you to identify them. I may give you a diagram of the oral cavity and ask you to identify it. That's different. All right, slide 27. Let's look at the muscles of the outer nose. There are 3 muscles that enlarge the nostrils and 2 muscles that constrict the nostrils. Learn these muscle names and their function. The first muscle, you may be interested in knowing, has the longest name of any muscle in any animal. I know it's really horrible, guys. I don't pick these. And again, I'm not going to ask you to identify these muscles, Just know that these three enlarge the nares and these three constrict the nares. And finally, slide 29, let's examine nasal pharyngeal movement to regulate airflow during breathing and speech, which is, of course, what we're interested in. Moving to slide 30. It's important to understand when examining the movements of individual muscles what the overall effect is upon the pharynx. Recall that we said that creation of different speech sounds is achieved through changing the shape and length of the cavities of the vocal tract, the oral cavity, the nasal cavity, the pharyngeal cavity that is separated into three groupings areas. So here you can see the ways in which the pharyngeal cavity can be shaped. And you just learn some of the muscles that can shape that cavity through contraction and relaxation. Slide 31, the movements of the nares change the amount of opening of the nasal airway. We don't typically think about dilating our nares in regular breathing, that is our nostrils, but it actually can become an issue at high levels of physical activity, like next time you're on the treadmill or you're jogging outside or you're running up the stairs late to a physical class and you've got a backpack full of books. Notice what your nares are doing. Your nostrils are flaring to allow more air in. But the flaring of the nares, the widening, can become an issue in cases of respiratory disease. All right, slide 32. The movements of the velopharyngeal port, the velum, the back wall of the pharynx, are critical to understand. Put a star in your notes. This is super important for budding speech-language pathologists. Contraction of the velar muscles results in closing off the nasal cavity from the oral cavity. And the next few slides highlight this movement. Do understand this movement. Note on slide 33 that the velum can be closed primarily by elevation of the velum, as well as by constriction of the pharyngeal walls, and also with both movements together. Furthermore, closure of the velopharyngeal port can be very firm or very gentle, depending upon the need due to the force of the airflow. Some speech sounds, like the P of Paul and the D of dome, require firmer closure than others because you're building up air pressure in your mouth. Requires firmer closure than, let's say, ah. Slide 34, most American English consonants and all vowels are produced using oral resonance. That is, the velopharyngeal port is closed and the airflow goes through the mouth. However, for nasal sounds like and the velopharyngeal port is open and air flows out the nose. Study the velopharyngeal port muscles and the pictures and understand clearly that contraction of the velar muscles raises the velopharyngeal port and closes off the nasal cavity from the oral cavity. Relaxation of the velopharyngeal port muscles allows the velum to relax, hang down, and open the velopharyngeal port. All right, slide 35. Oral sounds or high pressure consonants, like we said, like B and D. The velopharyngeal port must be closed very firmly to withstand the high pressure, air pressure that builds up inside the mouth during the closed portion of the B and D before consonants are released. Slide 36, during running speech, that is connected speech, when we're talking like I am now, the velopharyngeal port must open and close very rapidly to accommodate the different speech sounds and the non-speech inhalation. So I talk, I take a breath group, on a breath group, then I take a breath in, velopharyngeal port opens. Slide 37, during quiet tidal breathing, air flows through the nose and sometimes through the mouth, depending upon factors such as nasal congestion and also personal breathing style. I mean, that's not something you typically ask someone, you meet them in a bar. So, what's your personal breathing style? I don't advocate that as a pickup line. I don't think it'll work. All right. Slide 38. Here on slide 38 is presented lots of information about the lifespan development of the nasopharynx. Do read over that, please. All right. That concludes part 1 of the articulatory resonatory system. Now remember, and any questions you have, you can post them in professor's office. I check professor's office every other day. Or if you prefer, you can email me directly. All righty. So thank you for watching.